doctor once wrote that on the first day of medical school, they were told that fully half of what they were about to learn would turn out to be wrong in the end. They just didn't know which half it would be. At least a portion of that half is the part regarding back and body pain of musculoskeletal origin. You know, analyze is what we do, but when you know all the facts, it doesn't add up. Let me give you Exhibit A, the herniated or ruptured disc. Discs are pads between adjacent vertebrae of the spine, and like a jelly donut, the disc has a jelly center that's surrounded by fibrous tissue like rings of a tree trunk. And when a tear develops from the center to the outside, that jelly can squirt out to the outside like so much toothpaste at the end of the tube, right? And of course it looks for all the world like it's pinching a nerve exiting the spine. Now, this theory was in vogue well before the advent of MRI, when we could actually see the disc. And before MRIs, we only had x-rays, which can only look at bone. But because the space between bones where the disc would be looked degenerated or narrowed, we go, you know, it looks like you got a bad disc. Now, with the advent of MRI, we could actually see the disc, and aha, a ruptured disc like we always suspected. But then they did some pure research. Guess what they found? The disc can herniate to the right. Looks like it's pinching the nerve going down the right leg. Guess what? Pain goes down the left leg. There are people with herniated discs never had a back pain in their life. There are people with no herniated discs have radiating nerve pain of the foot. Half the population over age 40 has a disc, arthritis, something deemed significant on X-ray or MRI, but guess what? They have no pain. You know, here's the truth. Outside of fracture, infection, cancer, or other exotic disease, there's no correlation between the hard evidence of X-ray and MRI with back and body pain. There's no correlation between posture and pain. You know, but you want answers, and we pretend to have them because this is what's been ingrained, right? If you went to school and the consensus of scholarly thought said the Earth was flat, that's what you learned, right? And I was made aware that the disc theory, you know, MRIs were in vogue when I was in school, and I was made aware the science regarding discs didn't always add up. But hey, I'm a student. I'm trying to fit in. This is what has been entrenched, right? And I certainly didn't have been. So you just ignore, you know, you just ignore the facts that don't make sense. And again, because there you go. The theory seems so nice, right? And that's the industry is stuck on Earth is flat thinking. There is no science to back pain. But again, you want answers, so we tend to have them. And everyone's a genius because for the masses, back and body pain is what we call self-limiting. It's going to go away in a few weeks, you know, a few days, a few weeks, a few months, no matter what you do. You know, right? It's said that everything works and then nothing works. But everything works for 80, 90% of the time. And so and you want answers, and so we're, you know, coming at you all knowledgeable. Well, hear my truth. I can tell nothing by feeling or any manner of analysis. So let me take a step back here. If you don't believe what I'm telling you, you can ask Dr. John Sarno. He wrote this book, Healing Back Pain, the Mind-Body Connection. And there you go, he'll tell you, you know, it makes no sense. And he makes the leap in logic that since the hard evidence makes no sense, it must be all in your head, the result of repressed emotions and anger. And he invites his colleagues to verify or correct his work. And here's the missing link. He says, in the thousands of patients I've examined through the years, rarely have I found the involved muscles to be in spasm. That's it. That's what we've all been missing, underlying spasm. I would have you think of underlying spasm as more like shrink wrap. Nothing sticks out. It's like dark matter. Can't see it, can't feel it. I just know it's there. And again, so for back pain, but again, for back pain, for the masses, everything works. And then we never know who's going to turn into a tough chronic case. I just know I could never fix those dead enders until I came across precise leaf rake approach to treating muscles. And that's my background. As a chiropractor looking for answers, I have investigated a gazillion techniques of healing, right? And you know, you're young, you're open-minded, there's a little truth in everything. I'll put together the right combination of techniques for each client, you know. And so I have tried, you know, and again, they all work sometimes. And that's the funny things. Everything works. Sometimes it's some chiropractic adjustments. Chiropractic is around because sometimes it's miraculous. But we call it pop and pray. You pop their bones and you pray to God it works. You never know. You can't bank on it, right? And anyways, so I could not fix those dead enders until I came across a precise leaf rake approach to treating muscles. And what it does is it actually elicits the very thing doctors look for in examination and tests like discography. The patient saying, that's it, that's my problem. So it's all self-evident. It's in the muscles, we just haven't been treating them correctly. You know, most muscle therapies that I used to do is they're finger painting or they're mashing. And again, they're all miraculous most of the time. I know, that's what's so confusing. And we all want to take a crack at you because everything works most of the time. So everyone wants to take a crack at you. And again, we never know when it's going to work, when it's not going to work. Nobody knows, but everyone wants to take a crack at you. So anyway, here's the cases that changed my thinking. So when I was a young chiropractor out of school working for a guy up in Hollywood, I had a 68-year-old woman come in, and her spine, when you look at your spine front to back, it's supposed to be nice and straight. Hers was literally like this S. And not only was it S-shaped like that, it was so severely degenerated. You want to talk about bone-on-bone arthritis, and it took my breath away. I didn't know how she could be alive and walking around with this thing. And if it was up to me, I would have said, you know, I suggest you get your affairs in order and good luck. There's nothing I can do for you. But I was working for another chiropractor at the time, and he said, Brian, have a little faith, give it a go. So I did the chiropractic thing. She said it helped. I didn't think it would. She said it helped. She had numbness and tingling in her right hand. She's on medications for chronic low back pain. She said it helped get the numbness and tingling out of some of her fingers, right? Couldn't get out of her thumb. And sweet woman, and for 2 years, there you go. I'm throwing every technique in the book at her until I gave up. You know, I'm throwing everything. I said, we're not doing anything anymore. We're not accomplishing anything. There's nothing more I can do for you. I gave up working on her. And then sometime down the road, when I came across the leaf rake, I called her back up. I said, the leaf rake really impresses me. It might offer some benefit. I don't know. We did the leaf rake for a couple of years. Guess what? We got all the numbness and tingling out of her hand. She felt so good, she stopped taking medications for chronic low back pain. We got the worst spine I've ever seen in my life, symptom-free and stable. So what else can you conclude except arthritis pain is the result of the muscles gripping the joint and not the arthritis itself? With the leaf rake, again, when I came across the leaf rake, I gave up everything I'd done in my past. And I promise you, there was a time I never imagined I would give up adjusting because I used to love it, but I gave up adjusting. This does everything an adjustment will do, and so much more than an adjustment will never do. Adjustments don't recondition your muscles. And that's why people become unstable with repeated adjustments, because they don't recondition your muscles. But sometimes they are miraculous, no doubt. Anyway, so when I came across this, I gave up everything I've done because this is what I want done to me, and this is the only thing. There you go. I save people from knee replacements, hip replacements, but the worst thing about it, it is the opposite of magic. It's work. And so really, if you have a friend, a loved one, anyone willing to do the work, because I say, stop analyzing and forget what you think you feel. It will lead you astray. It's this simple. Muscles can tweak anytime, anywhere. And that's why there's no correlation to X-ray, MRI, or posture, because muscles can tweak anytime, anywhere. The tweak itself is typically minor, not the problem. What's causing your symptoms is reactive contraction or spasm. But again, most often, there is no apparent spasm, right? So it's like dark matter. So all I ask you is where it hurts. I think of a bigger picture than just the spot that hurts. I scan the fundamental patterns with my leaf rake. You're going to tell me what's involved or not involved in your condition because I can't tell. You're going to tell me, and it varies to the individual, right? A tweak might set off a part of one muscle, might set off a whole group of muscles. Each case is a puzzle to solve. And yeah, I have reduced myself to a voice-activated robotic arm. And the worst part about the leaf rake, it's work. And there you go. It's as simple as a leaf rake, and it's as complex as a golf club, which is also simple in principle, but as anyone who plays the game knows, it's not nearly as easy as it looks to do it like the pros. So, AMR, it's simple, it's complex, it's accessible to anyone because at its basis, it's as simple as a leaf rake. And as we go around the body, some places, there you go, some places it's pretty gosh darn simple, some places you're gonna want some precision and whatever. There's a moment for everything. But so that's the thing, if you have a friend, a loved one, anyone willing to do the work, this is what you're not getting from modern medicine, right? Because you're gonna get pain meds, cortisone, stretching and exercise, proper reconditioning of your muscles is what the whole world is missing. And again, I think it needs to be automated for the same reason we have harvesters and chainsaws and dishwashers. This for the same reason we have power steering and power brakes. And when that happens, the leaf rake is going to put a lot of people out of work because it's just tapped into a deeper truth. People will fix themselves at home or at the gym because once you understand the fundamental patterns, and all we do is scan them. Your body's, you know better than anybody where the it spot is. I can't tell you. Only you know that is. And only you know where to follow it, right? And people will fix themselves at home or at the gym. So yeah, I have nothing more to do but to pass this on, and I have a weekend seminar, Saturdays and Sundays 9 to 3. I give private lessons, and what I love is that people are able to get it from the book alone, right? And really, what you need more than anyone is someone willing to do the work. You know, fixing chronic pain conditions, it's 99% perspiration and 1% inspiration.